Hello again. Welcome to Safety and OSHA Standards module. This is the introduction. This one's going to take a little bit of a different approach later in that we're going to switch from this inserted overlay of me on the PowerPoint and then go to the other version where it has the insert of the PowerPoint on the live classroom action. Sounds all real high-tech and all that kind of stuff, but actually I lost I can't find the footage of the introduction, which is only about 4 slides, so I thought I'd go ahead and just do it. It also has an introduction to a skill for fire safety and fire extinguisher use, and we will insert that later also as we get ready to submit this final video clip. So without any further ado, let's get rolling, let's get started. The objective in this unit is to identify all the elements of a safe and secure working environment underneath OSHA Occupational Safety and Health Administration guidelines for a healthcare facility, to look at those standards and look at ways to keep yourself safe while on the job. As I said, the first thing we're going to talk about is fire extinguishers, the different types and how to use them. First of all, as you see on this slide, there are 3 basic types of fire extinguishers. However, you can have combinations or individuals of each of these types. In other words, you can have an ABC fire extinguisher, you can have an AB fire extinguisher, or you can just have an A fire extinguisher. First of all, the A fire extinguisher is just pressurized water. It's used for normal combustibles, as would be fire and paper and those types of things. The B-type fire extinguisher has carbon dioxide in it, CO2. This is used for petroleum-based fires like gas and grease and other types of things. And then the last one, of course, is fire extinguisher type C. This is potassium bicarb and potassium chloride or potassium chloride. These are used for chemical and electrical fires that you may have in the workplace or around the home or anywhere. But obviously you'd want to have that present in a lab or a electrical facility. This slide here is telling us more about how to use the fire extinguisher that you'll see in a skill in just a moment. But it also points out a picture of the gauge whenever you get ready to do a fire extinguisher on an emergency or as a skill. First thing you need to make sure is the right fire extinguisher that we just talked about, the A, B, or C. Then you need to check and make sure that it is fully charged and has been serviced. If it's fully charged, you'll see this gauge that's on the screen here, and it will have the needle inside the green, and that means it's ready to go. It also may have a zip tie or a type of tie around the handle, the squeeze nozzle, and this will also indicate that it's been serviced along with the tag of the inspection date. You can see all of those things in the other picture that is on the screen in front of you. Now, even when we go to the hospital and we get our name badges, we have a little acrostic on the back of them that helps us remember how to use the fire extinguisher. I'll be going over this in the skill, but let me go ahead and go over it real quickly right now with this slide. First, well, the acronym is PASS, and first P stands for point. That means you point the fire extinguisher, the nozzle, directly at the base of the fire. Don't spray at the top of the fire or the flame. Go to the source of the fire. You can spray the top all you want and you won't have anything put out. Matter of fact, spoke with several firefighters and they talk about training skills that they use for firefighting school. And they start small fires and give all the new trainees a fire extinguisher, and they're amazed at how many of them go at the blaze but not at the source. and they'll sit there and exhaust an entire fire extinguisher and not put out the fire because they're just shooting at the flames, not at the source of it. So the next one, the A, is for aim. That is the aiming at the source of the fire. Then the first S is for squeeze. You will have to pull the pin and then you can squeeze the handle. As you squeeze the handle, it will start to discharge the chemicals and water and what have you that's in your particular fire extinguisher out the end of the nozzle. And then the last S is for sweep. Sweep across the base, the source, kind of back and forth with the end of the fire extinguisher. There's a lot of different rules of thoughts of this, and I'll talk to you about it more during the skill, but most of the firefighters that I've spoken with say it's best for you to invert the fire extinguisher if physically possible. That means turn it upside down so that all the chemicals will rush to one end of the fire extinguisher and be discharged out the nozzle. Holding it upright, manufacturers of the fire extinguisher will say, yeah, that's fine, we have built them so it will bring up all of those chemicals and spray them, but firefighters who do it on a regular basis say it's best to invert it if you possibly can. So our skill is going to include inverting the fire extinguisher as we go and extinguish a fire. That ends this little FaceTime intro to the Safety and OSHA Standards module. Don't forget, pass, point, aim, squeeze, and sweep. And now we're going on to a small video of the skill, and from there we'll go into the live classroom lecture portion of this unit. Remember, as it says in the intro also, there's plenty of things that surround this that you don't get to see. You're only getting to see the PowerPoint, the lecture, and the time that we spend in class. You're not seeing the supporting workbook work, activities, projects, and things that we're doing during this unit. So may want to check into those things if you want to fully grasp everything that this unit is trying to teach you. Thank you again. Alright, hello everyone. We're here to illustrate the proper use of a fire extinguisher. Don't forget your acronym: pass, pull, aim, squeeze, and sweep as we go through this skill. Alright, what we have over here is what we would call a fire of manageable size. You are going to walk me and talk me through what you would do to perform this skill. First of all, before you even get started, if it's not of manageable size, pull the fire alarm, exit the building, making sure that your instructor and your fellow students can get out of the building safely. If it is small to manageable size, you can attempt to extinguish the fire, but do let everyone know that a fire has started, and it's a call for your facility as to whether you should initiate the fire alarm system or not. Some facilities say go ahead, others say if it's manageable and they're routine fires, like in some shops and what have you, where they have fires on a regular basis, they don't pull the alarm every time because it would activate the sprinkler system, tear up equipment, and all sorts of stuff. So you have to let your facility kind of tell you that. Okay? So here we have a fire of manageable size. I'm going to stay a safe distance away from the fire, and I'm going to activate the fire extinguisher skill for putting out this fire. First thing I do is go over to where the fire extinguisher is located. Normally it is on the hanging hook that is over there, but for this video I've moved over here to the table. I'm going to make sure that it's the right type of fire extinguisher. Okay, we'll assume that this is a wood-based fire, so A would be the one that you would want to get, but this is an ABC, so it is good for just about all types of fires. Next, I'm going to make sure that it's been serviced and that it is fully charged before I get it. If none of those criteria are met and you don't have another fire extinguisher readily available, pull the fire alarm, inform everyone, and make sure everybody gets out of the building safely. But this one is charged, and it is the right type of fire extinguisher. Now we don't want to reservice these, so realize everything is going to be an illustration. I will not use, like I said, a real fire, or I will not officially discharge this fire extinguisher. As I get it, I'm going to cradle it. This is probably one of the hardest things for a lot of students to get, is the cradling, to invert it and to make sure all the chemicals come down to the bottom of the fire extinguishers. As I said, some manufacturers will not say that is necessary, and with larger fire extinguishers it's probably impractical to do it, but with this type it is. This one has an attached nozzle, so you'd have to get the attached nozzle and be able to hold it and aim it at the base of the fire. You would pull this pin and squeeze these two paddles together. Then, as I said, staying a safe distance from the fire, you will point at or aim at the base of the fire, the source of the fire, and you will slowly sweep the head of your fire extinguisher across the base, extinguishing the fire. Okay? Should this not put out the fire, same as before, pull the fire extinguishers, inform everybody in the classroom, and make sure that they get out safely. Or if it continues to grow and you are unable to fight the blaze because it is growing too quickly, pull the fire extinguisher and exit from the building with your classmates and your instructor as quickly as possible. Thank you. Alright, so yeah, exit, fire escape plans, all that kind of stuff are definitely necessary. Any type of facility. I mean, you know, you go to a hotel, it's got to be on the back of the door. If you go to a hospital, it's got to be on the back of the door. Fire escape routes and that sort of thing. And of course, the lit signs that we talked about and the fire alarm. The safety shower. We have one here, and we'll go check that later on. Maybe not today, but later on next week. We will go and check it. But you have to have a system in place where you check it on a regular basis to make sure it's functioning properly, make sure it's clean, make sure it's clear of all obstructions. There's all sorts of guidelines you have to have. The safety shower, we don't have to have one in here because we don't have advanced chemistries in here. You have to have one in the chemistry department and the biology department because they have advanced chemistries, formaldehyde, all sorts of things. So it's something where if you pull the lever, it's easily accessible, there's no obstruction. When you go up there and you pull that lever, it will douse you with water continuously for 15 minutes straight. Okay? And try to get all the hazardous chemicals off. Do the 9-minute assessment, that top one. Just click on that. There you go. Alright? That one just happens to have a safety shower and eye wash built into it. See how it's eye wash on the bottom and safety shower on the top? That's one of the green ones. The eye wash station we're going to talk more about later, but that's definitely one. That was a good
What's
answer.
our shower thing?
Your safety shower for the school. It's in that little, it's right next to the suction vent in the lab, by Mr. Howard's lab. We need to have one for agri-science too, and there ought to be one. When y'all do a lab in chemistry with Mr. Money, y'all leave and go up to the lab by Mr. Howard. Yeah. So.
Why would you need one in ag?
Because they have advanced chemistries in there. Everything from fertilizers to gasoline to that sort of thing. So you're supposed to still have one. Fire alarm and siren lights that we've got here, those are specialty features that you have. You pull it one time, you don't have to sit there as it continues to activate. And it has to be on a separate power system from the existing power system supply. So if something happens to that, it has to sort of be standalone. And then, like you said, the biohazards. We're going to talk about that. That has its own section later. It's biohazards, simple one. Another thing that we don't have to have is a flammable goods locker, but in agri-science they've got to have one. It can handle blast and flame. It's where you keep things like propane, acetylene, gasoline, all those types of things go inside that locker in case of a fire. Kind of protects you. If you're even in that room, there's a small fire and those explode inside that locker, you're not going to have a whole bunch of exploding debris because it's going to be contained. And it's also going to help keep them from catching on fire because they're separated out. Alright? Any questions about these additional safety features? Know the lingo. Here are some of the biggies. You might want to spend extra or pay extra attention to all of this. Yep, human immunodeficiency virus. Okay. This particular virus attacks your immune system, and we're not going to spend a whole lot of time on this. There's a whole unit dedicated to it, but do you realize a lot of times when they say that a celebrity or somebody dies of something that's kind of weird, and you're like, you can die from that? A lot of times it's because they have HIV. They just don't announce that they had HIV. Why is that the case? Well, now, the common cold, if you catch it with HIV, your immune system can't fight it, and you go into ARDS, respiratory distress, acquired respiratory distress, because of the cold. You can't fight it off. It gets worse and worse and worse, and literally you could die from a common cold because you have HIV. Other types of illnesses that all of us can fight off. Somebody who has an immune system that has been affected by HIV can't fight it off anymore. Now, there's no vaccine for it. We talked about this during the orientation. We wish there was. And now it has mutated several times. And why is it so dangerous? Why is it such a problem in the regular population? Because it lays dormant for 10 years sometimes. So this person can go around having sexual partners, having IV drug use, having surgeries and all sorts of things for 10 years, show no signs of it, and then boom, show the signs portion, which is the AIDS, the acquired immunodeficiency syndrome that develops from it. Inside the human host, inside blood, it is almost impossible to kill it. But we do have some regimens of drugs that we give that are having some success. Out on a table, 10 seconds. Ultraviolet light from the sun kills it. Ultraviolet light from these fluorescent lights can kill it. It's very fragile outside the human host. But inside the human host, it's a booger. And like I said, they can carry it around. You see Ebola, and we talked about Ebola, and Ebola, they have hemorrhagic fever. They're bleeding out of most of the orifices of their body within 2 weeks. Is anybody like that going to have additional sexual partners? No. I hope not. Are they going to have a lot of chance to go have IV drug use? No, because they're bleeding out of every part of their body. So it usually kills the person quickly, but we've had some success in treating it too. But HIV, it is a booger. Now, for healthcare people, we know the dangers of it. We know how to protect ourselves from it. You're learning about it right now. So we're less likely to catch it. HIV in the healthcare population is at the lowest percentage of almost any career. Matter of fact, the only one that I have heard of directly, I've heard of a bunch, that has occurred has been in the sanitation business. Garbage man. They didn't know, didn't think about it. He picked up a trash bag and it had needles in it. And needles stuck him in the calf. And he got HIV. And then the other ones, of course, have been associated a lot with the homosexual community. But that is not exclusively what it's related to. If you take this full class with me, you'll find out the highest population of HIV is where?
Africa.
In the healthcare industry, we know that if we have a stick we can go and start a gamma globulin series of injections and we'll never catch HIV. I've had a stick before. I got stuck while doing missionary work down in South Africa. I went through the testing and never showed any signs of it, so I didn't have to go through the gamma globulin series. Nor did the patient. We went ahead and took the patient that was involved and had that person checked, and they didn't show any indication. So I didn't have to go through the gamma globulin. Take care of you. Hey, and I hope you go to the bathroom again somewhere else. So. But because of our knowledge in healthcare, we actually protect ourselves better than the general population, so we have less of an occurrence of the illness. I'm not saying it doesn't happen in the healthcare industry, but just with more knowledge comes better safety with it. Okay. Oh, I never told you the answer. The answer is adolescent, heterosexual, white females. Sorry, I didn't give you that news, but that's the highest population of HIV.
So you said the shots, you would never get HIV, so why is everybody
You won't get it from that injection, that stick. Go for a couple years, gamma globulin wears off. It doesn't immunize you for your life. I'm just saying, if you get that one stick, you can go have the shot series and you won't catch it. How many times does a drug user think, just because they use a needle from somebody else, oh, that person may have it, let's go get checked over time. And if they continue to have it, the gamma globulin will kill them. Because it can be rough on your system. People with sexual promiscuity, they don't get through that night and say, oh gosh, I better go get a gamma globulin series of shots to keep from getting it. Yeah, it just, it's a hard word to say. Say it a whole bunch of times. Okay? But for the healthcare industry and the incidental sticks or cuts during surgery, then you've got the other occurrences from small things, because the people in healthcare, they have lives outside of their job also. But the occurrence of healthcare itself is low because of their knowledge of it. It's all around us. Of course, the best thing you do is monogamy. Okay? Or abstaining. Okay? Abstaining. It's the best thing you do. And it's mutated several times now. And we're going to talk about this more in just a moment. So I'll go away with a moment. After you have developed the full parts, I don't know the best way to say it without saying the word itself, of HIV, it turns into the syndrome. And this is the syndrome, the acquired immunodeficiency syndrome. Now it's impacted your immune system so much that you're starting to suffer from the side effects of that attack on your immune system, and you're starting to get all sorts of illnesses. A lot of psoriasis starts up. Your liver can't filter stuff out anymore. You develop sores and pustules and stuff all over your body. Then you start getting all these little illnesses, and regular medications don't seem to fight them. You can't seem to get well. And that's the syndrome part, and that's what's leading up usually to the person's demise, is when they get to this level. The tests for HIV and AIDS, the most common ones, there are more that are all out on the market now, but these were the first two, were the ELISA test and the Western blot test. Both of them were protein assays. They checked for a particular protein that was in the HIV virus, or a protein that your body would produce if you caught it. Okay? So therefore, a lot of babies, and this is a little bit of a sideline, babies showed positive for HIV because of the mother, but in some cases, the baby didn't have it. Why? Because of breastfeeding and the exchange of these proteins, the baby had the protein that the test would pick up, but then after a couple of months, it would go away because they no longer were breastfeeding or inside of the mother. Okay? Ironically enough, Charles Barkley back there in that book, right after he announced that he had HIV, his wife and he had a child. She was already pregnant before he found out that he had it. What did they name that child? Eliza. There's a little irony in that. But that's an acronym, by the way, for it hit me a little. Within the strain asset. Anyways, neither one of the tests are 100% effective, especially now since the virus has mutated in different strains. But how do you make the test more effective? Well, you follow the directions, you make sure a healthcare provider does it, but what else? Do both of them. Okay? If you want to make it to where your percentage of success on the test is higher, and one test is an 84 percentile and the other one is a 92 percentile, you want to do the 92 percentile, but if you do both of them, the test results are like 98% accurate. So do both of them.